Hello, welcome to Code Rhetoric with Tam Talk. In today's segment, we will be focusing on sepsis. Again, this is Medical Coding 101 ICD-10-CM Coding Guideline Review. The ICD-10 General Coding Guideline states for sepsis, severe sepsis, and septic shock. First, sepsis. For a diagnosis of sepsis, assign the appropriate code for the underlying systemic infection. If the type of infection or causal organism is not further specified, assign ICD-10 code A41.9, which represents sepsis, unspecified organism. A code from subcategory R65.2, which represents severe sepsis, should not be assigned unless severe sepsis or an associated acute organ dysfunction is documented. The ICD-10 General Coding Guideline goes on to state that negative or inconclusive blood cultures in sepsis do not preclude a diagnosis of sepsis in patients with clinical evidence of the condition. However, the provider should be queried. Urosepsis. The term urosepsis is a nonspecific term. It is not to be considered synonymous with sepsis. It has no default code in the alphabetic index, and should the provider use this term, he or she must provide additional information or clarification, and they do this by the coder querying the provider. Sepsis with organ dysfunction. If a patient has sepsis and associated acute organ dysfunction or multiple organ dysfunction, also known as MOD, the coder is to follow the instructions for coding severe sepsis. Acute organ dysfunction that is not clearly associated with sepsis. If a patient has sepsis and an acute organ dysfunction, but the medical record documentation indicates that the acute organ dysfunction is related, to a medical condition other than sepsis, do not assign a code from subcategory R65.2, which represents severe sepsis. And I'll repeat that. If a patient has sepsis and an acute organ dysfunction, but the medical record documentation does not indicate that that organ dysfunction is related to the sepsis, do not assign ICD-10 code R65.2. An acute organ dysfunction must be associated with sepsis in order to assign the severe sepsis code. If the documentation is not clear as to whether an acute organ dysfunction is related to the sepsis or not, or another medical condition, the coder must query the provider. Severe sepsis. The coding of severe sepsis requires a minimum of 2 ICD-10 codes. Your first code should represent the underlying systemic infection, followed by a code from subcategory R65.2, again, which represents severe sepsis. If the causal organism is not documented, assign ICD-10 code A41.9, which represents sepsis unspecified organism for the infection. Additional code or additional codes for the associated acute organ dysfunction are also required. Septic shock. Septic shock generally refers to circulatory failure associated with severe sepsis, and therefore it represents a type of acute organ dysfunction. For cases of septic shock, the code for the systemic infection should be sequenced first, followed by code R65.21, again, which represents severe sepsis with septic shock, or code T81.12, which represents the post-procedural septic shock. Any additional codes for the other acute organ dysfunctions should also be assigned. As noted in the sequencing instructions in the tabular list, the code for septic shock cannot be assigned as a principal diagnosis. In other words, septic shock cannot be listed as your primary diagnosis code. In our first coding example, our patient is admitted for complications due to acute renal failure and severe sepsis. So in our first book step, we're going to locate our main term, which is failure, and the type of failure is renal. And because it is acute or chronic, and the doctor specified that the patient presented with acute renal failure, we're going to drill even further to acute. So based upon those book steps, our ICD-10-CM code should be N17.9. Then in our second book step, we're going to identify sepsis. And our ICD-10-CM code should be R65.20. Again, remember the guideline states that if the patient has an acute organ dysfunction along with sepsis, we are to code 2 ICD-10 codes. So our rationale for this particular example is the patient is experiencing complications associated with acute renal failure as well as sepsis. Therefore, the documentation reflects the sepsis and acute organ dysfunction are related. The coder should assign ICD-10 code N17.9 as the primary ICD-10 code, and then R65.20 as our secondary diagnosis code. In coding example number 2, the physician diagnosed the patient with urosepsis. So in our book steps, we're going to locate urosepsis in our alphabetic index. And once we locate urosepsis, our ICD-10-CM code statement reads code to condition. So again, based upon the guideline, urosepsis is a non-term or is not non-specific to sepsis. So therefore, this is the prompt for the coder to query the provider for additional information regarding the patient's condition. So our rationale is, again, per the guideline, the coder must query the provider for more clinical information since urosepsis is not a specific diagnosis or ICD-10 code. So this segment's coding tips is always determine if the acute organ dysfunction and sepsis are related, or if the acute organ dysfunction is a complication of the sepsis. Secondly, severe sepsis requires a minimum of 2 ICD-10 codes. Third, always remember that urosepsis is a nonspecific term and is not related or is unrelated to sepsis. Always query the healthcare provider for additional clinical information surrounding the patient's condition. Always remember to code to the highest specificity. And as always, when in doubt, always reference your coding guidelines. This concludes our Code Rhetoric segment with Tam Talk. To learn more, please follow us on YouTube at Abraham Medical Coding Coach Abraham, or by visiting our website at www.abrahammedicalcodingcoachllc.com. We have our coding blog entitled The Medical Coder Post, and you can also follow us on Facebook, Instagram, and Tumblr. You can get in contact with me via email at abrahammedicalcodingcoach@gmail.com. Thank you for tuning in.